Okay. So as you wait outside, this is the thing which is given to you. This is a video session without an audio. You may see the video multiple times. Case summary, we will have a short summary. So we have a 6 years female Princey who is presenting with skin rashes for 2 days. Okay.
Okay.
So shall we proceed to the video? We want some time.
Yes.
Okay, so we should proceed to the video. So we'll have to see the video again.
Yeah, once.
And wait again.
Okay. Okay.
Okay.
So what I see in this video a 9-year-old girl who is on hospital setting. The girl is well alert. There is no any device attached. The child is not distressed. She's average for age, though I want to plot on appropriate growth chart. What I notice there is rash on the child, some skin spots and rash, mainly much more in the lower part of the leg, lower limb, and some on the hand. That is I am seeing.
Okay. So what are the differentiates?
So my diagnosis, it's a case of rash on top. It can be Henoscoline purpura. It can be idiopathic thrombocytopenic purpura. It can be Kawasaki. Okay, sorry. HSP, ATP, meningitis, meningococcemia. It can be any viral rash. It can be any drug reactions, any allergic reactions. Any this.
Okay, so what questions you would like to ask in the history?
First of all, I want to ask when it started, how long she's suffering these conditions. Is that anything increase this condition? Anything decrease these conditions? Is there similar conditions in contact with that? About fever, I will ask, is there any fever, preceding fever previously occur or not? How activity affected or not? The child has any lethargic, any sign of headache, neck stiffness, anything? About how about the urine output? Is it first time occur or previously occur? Is there any drug she has taken any medicines before that? Any chronic illness she has? Any visiting any endemic area, any mosquito bite, anything area? And her consciousness, she's conscious. These are.
So what we're going to see in the examination?
On examination, I want to do first the airway breathing and circulation ABC, vital signs, and to measure the blood pressures. I want to fully general examination the child about the rash. It is blanchable or not blanchable. These any sign of meningeal irritations, I will search. Examinations.
Okay.
Any other side of bleeding occur or not, I'll examine these.
Okay. So considering this as a case of an venous purpura, so what investigations would you like to do?
Okay. So if it is first of all, I will do the urine test. I will do. Is there any hematuria present or not? I will do the full blood count, blood pressure monitor. I will monitor blood pressure, urine examinations, proteinuria present or not. These I will say, and if needed, coagulation profile. If it is okay, these are not coagulation profile. These.
So when would you admit this child?
I want to admit the child.
When would you admit this child? What are the indications for admissions?
So indication admission is there is severe abdominal pain, macroscopic hematuria, unstable blood pressures. She has and orchid. Sorry, she's a girl. These are.
So would you like to give any advice for this child?
Advice.
Yeah.
Yeah, advice is that I will give that advice. The child she'll be under follow-up, under GP follow-up. We'll monitor blood pressures and we'll monitor the urine. Urine will check. Is there any proteinuria present or not? That is.
Okay. What's your feedback?
My feedback.
Yeah, will be performed.
I miss the abdomen examinations, abdominal pain history. It needs to ask, and it's purpura. Walking, about the gait of the child, I need to ask history. That is urine color. I ask any hematuria through the urine. That is, this needed to be asked. Fever, upper respiratory tract infection previously.
So, we put up in the group. Anybody wants to give some points here? Yeah, that would have happened. Okay. She did mention about the blanchability and joint examination. Yes, she mentioned it now. So from my end, the first thing is like you decide a setting. So that's a very good point to start up. So always in a video, you have to start with the setting. So here you talked about the hospital setting, the patient is lying down supine and she is comfortable. So she is not sick looking. So that's a very good way to start. Okay. So you mentioned that there are no devices, but I found that there is a pulse oximeter. I think there's a monitor there showing saturation and heart rate. So there was a device there. Okay.
Okay.
So you did mention that child is not in distress, so that's a good thing. You would like to talk the side on the dimensions you mentioned, so that's a good thing. And you mentioned about the purpura that is more the lower limb, so that's a very clear finding. Okay. So these are things you mentioned in your initial findings, and you gave a differential of ITP, then sepsis, neocortinia. So those are good things. Okay. So that's very relevant. And ITP, the hospital sepsis, those are things that are very relevant. And history part, you mentioned about the onset duration. Those things you have to ask. Okay, fine, you mentioned, but as you told that you forgot to mention about abdominal pain, joint pain, those things should be asked. And the past history of any preceding viral infection, you asked about fever, so that's a good thing. Okay. So the examination part, you told that you will see the vitals, so that's a good thing. Okay, so because the child is sick, then the management will get there. The child is stable, the management will get there. So that's a good thing to solve. And you did mention about the proper blanchability. You can always tell like a glass test, you may do the bedside. So investigation part, you mentioned about the importance of routine urine, blood counts, and urine protein monitoring. Okay, so these are two things. You mentioned about BP in investigations, but BP can bring it under, I think, examination part itself. And admissions, you mentioned about severe, moderate to severe abdominal pains and indication. So proteinuria is an indication. You mentioned, okay, so that's good. And so those are the points. I think you almost covered the major crux of the video. Maybe to add more, the thing is like general examination, you can do like as like an the clinical session. So you can comment about the devices and you can comment about the 4Ds as we have mentioned. The child is not in distress, one is not present, dimensions are like a plot, so like this you can tell. And always describe the full video. For example, in the initial part of the video, the child was showing the hands. Okay, in the hands, the papura is more on the extensor aspect. So more the dependent region. So it's a dependent papura, as well as in the lower limb, it is more the extensor. So these are all like you go with the flow of the video. Okay? So you have time there in video sessions. You have 3 minutes to describe your conclusion. So go very slowly. Start with the setting, give a general examination finding, then go slowly the initial part of the video, the middle of the video, the end of the video. So you can tell like that. You can mention the papyrus more, the different region more, the extensor part, and then the oral cavity they showed. The oral cavity there are more patients, so that is a point against ITP, right? So you don't have any mucosal bleeds. So you can also mention that you can mention some findings. These evidences are. So those are not relevant, but still you have seen that in the video because you have 3 minutes time to present your findings. Okay. You can also tell that considering that there are no obvious joint swelling, child doesn't look sick, child is comfortable. So that's why you can tell about the findings. Okay. In history, as I told, you can ask about joint pain, abdomen pain. Okay. So my point is like whenever you have a differential, you try to include all your differential into the history. So you mentioned about ITP, so talk about those mucosal bleeds in history. You mentioned about sepsis, so we can tell the child is sick, child is lethargic, febrile, those things, other sensorium, those things you can ask. And one part differential is, my suggestion is like whenever you have a video session like this, always have 3 differentials. It is better limit ourselves to 3 differentials so that we can focus what are the things we can ask for those 3 differentials in history and what we will do, see in examination for those 3 differentials. So here, one thing is like ITP. So the point, as I told that you go a differential, you can always mention by the side itself, but there are no mucosal bleeds. I would like to consider ITP down the lane. As the child is not very sick looking, sepsis and leukemia is down the lane. Okay. So one hard differential you can always think for the registration. So this is HSP case. So you can, for a Karpura, you can have it like a malignancy, like a leukemia, which can have Karpura also can be presentation. So child may not be very febrile. The initial part may not be maybe very can be very sort of kind also. So that thing you can always have. So you can ask about constitutional symptoms in history, and particularly if it is close to adolescent, also mention about the health history and so on. So in case for completion part at least. Okay, if you are talking about meningococcemia, you can add a point about the vaccination history. You will ask about the vaccination. So that's what child. Okay. So examination part, I think you covered. You mentioned whether the vitals, the child is sick or not. Then you can see the computer glass test. You can do a blood pressure measurement at the bedside. For this case, you can comment about abdomen examination, joint examination, and if it's a male child, you can go for a genital examination for all babies. Okay, and always abdomen, rule out any abdominally because that will be finding which will push the diagnosis further towards a malignancy. And investigations start at the basic investigation, blood count. If you mentioned, tell about you're looking for the thrombocytosis, you can always tell what you're looking by in the finding. Protein urine, you're looking for an RBC. You're looking for maybe an RBC class, or you're looking for something like that for a Manchuria. And you can look for protein urine also. Then if the patient has an abdomen pain, then you can add up. Okay, so as I told that I have given the differential. So answer this case as HSP, what registration you will do. So if the patient has an abdomen pain, then I will do a ultrasound abdomen. I will do a stool for occult blood test, and if the patient, if it's a male, if the genital pain is there, then I will do 1,000 Scotland. I'll do a docket. So that way you can add up your investigations for focusing towards your spinal background. So admission indications for admission, I think the guidelines: moderate to severe abdomen pain, arthritis involving more than 2 joints, arthritis in a male child, and proteinuria, and history of GI bleed, and a child who is sick or inability to ambulate. These are the points you are looking for admitting this child. Okay. So these things are the guidelines you can very well guidelines.
Okay, thank you.
Sir, Dr. Balaji, any comments for
anybody else wants to add up to the feedback? Vasan was asking, can I ask what's in the mouth and the tongue? Actually, I think they were pointing for any mucosal bleeds. It was not there, mainly for ITP and other bleeding problems. No, so mucosal bleeds. So in HSP, we don't get that. So that's what they were pointing there. Emma, when exam actually? I think you're almost ready for your exam.
Actually, my exam I'm planning for booking November from Nepal station, inshallah. So my exam would get delayed, go November, because Nepal they set on that
But
time.
you look almost ready for May, June.
Thanks.
Because giving a spontaneous station, you're able to do this much. Actually, it's good, appreciable.
Okay.
One question I wanted to ask, like the 3 minutes, what were you doing initially when the video was there? Hello, Emma? Are you there?
Yeah, I'm here. 3 minutes, what I do?
So you watched the video?
3
and
minutes. See.
What else you were doing?
I was first looking for the diagnosis. Okay. But I'm really confused when she's starting from the hand and also showing the tongue that is going for ITP. Then the rest when I see, then it is, I think it's going HSP. But
So,
HSP, ITP.
So you kept the diagnosis, then what else you were doing at that 3 minutes?
First of all, diagnosing, then I start that the child is this age, she is there any device, she's distressed, how, and average short, tall, fat, that is average for age, I notice, then I, what positive find, I find.
I think Sarah
What is
was
the
asking you like what you are thinking.
Not in the
for
detail,
initial
you
3
were
minutes.
saying that for others also. So the 3 minutes are very crucial. So do not keep on looking at the video again and again. So take the points, maybe 1.5 minutes. Remaining 1.5 minutes is what very important. Examiner is not going to disturb you. Write down your differential diagnosis. So what are all the differential diagnosis? Write it down. Examiner is not going to disturb you at all. So write down all the differential diagnosis. Then write down all the relevant history, what I am going to ask. At least few points for each of the diagnosis. What are the examination findings I am going to look for each of the differential diagnosis? Then I think an examiner will give you a clue towards a specific diagnosis. Okay, assume it as HSP, and you also know it's probably HSP. Then you prepare your investigations and management according to the diagnosis. So that 1.5 minutes after seeing the video is very crucial for you to prepare for the 6 minutes of the talk. So that's what the main advice I would like to give for all. And Emma did well in that part. Maybe I think you should have concentrated more on HSP when it came to the history. All the complications of all the symptomatology of HSP you should have asked in the history. So it will start from abdominal symptoms, joint pain, and urinary symptoms. So that part maybe the history part. Then the red flag, you always will have that red flag of meningococcal and leukemia. So your history should go towards ruling out leukemia part. So how is the other cell lines? What happened to the other cell lines? So pallor and its symptomatology, and fever. For meningococcal, I think fever you did ask for meningococcal fever and altered sensorium, seizures, vomiting, headache. You asked that part. For leukemia, you could have further elaborated. And most important for meningococcal, the vaccination status. I think that's a very crucial question. So vaccination status for the meningococcal. I'm happy that you took drug reaction in the DD. Almost any rash keep drug reaction in it, and also viral infection. So viral infection, you took it right. So that was good. In examination, at the end you picked it up. At the end, I should have done the abdominal examination. You said so that should have come at the start, because here in your DD for both HSP, abdomen is important. Similarly, leukemia also abdomen is important for organomegaly. So that part you did. Did you say CBC, hemogram?
Full blood count. Full blood count, I told.
Okay, I might have
She
missed.
mentioned.
So, as suggested, always start from bedside investigation. I think she did that. So, blood pressure and urine are very crucial bedside investigations here. And I think all questions will come from the pediatric guidelines. So, make sure you all read for all the videos. So, the questions will be straight from the pediatric guidelines. So don't miss out reading the guidelines. You need not be elaborate in the guidelines, but at least the basic stuff you should have read, like what will be the criteria for admission. I think you have to be more thorough, Dr. Emma. So criteria for admission. So it's clearly given in the guidelines. So whenever there is
Okay. Okay, sir.
two joint involvement, unable to walk, renal involvement, moderate to severe abdominal pain. So all those I will be admitting. So just prepare. Still time is there for the guidelines. Otherwise, you did well.
Okay, sir. Thank you.
All the best, ma. All the best. Okay, so Sabri,
Any
any other
questions?
any other points, or we shall wrap it up.
Questions from the audience? Like, so maybe the one take home, biggest take home message I think you can have from today's session is like the video session does not waste those 3 minutes looking at the video. So you try to have a 3 differential diagnosis. I would say do not try to have too many. So you might get away, be diluted. So have 3 differential. So one, always have a hard hitting differential, because the whole purpose of MRCPCH exam is to see how safe or you are. So you should not miss a malignancy. So that's the crux. So have 3 differentials, out of which one should always be a very rare differential, which is very hard hitting. And one can be soft, and one what you think is a common topic. So that way you can have it. So think about what you will ask in the history, what you will ask in the, what will you do in the examination part, and what will you do in the bedside part for all these 3. So that would be a good way to, because you have full 6 minutes in the video session, so you have a lot to talk there. Okay. So think about those things when you're free, rather than just seeing the video again and again. If you're okay with the diagnosis, then we can think all these things. And similarly, when you're waiting outside for the clinical sessions, I think the best thing you can do that is like you can, if your session is slow, please keep the mark sheet of that session so that you'll be ready to hand it over to the examiner. Okay. So as you enter the session, the examiner will introduce himself and he will tell, I am so and so. So this is your session. You can just hand over the examination sheet, introduce yourself to the examiner. Okay. So that way you spare some 2 seconds there. So do not go and search for the session there. So another important thing is do not carry what you had in the previous session. So just forget what happened in the previous session and go with a fresh mind for the clinical sessions. So no further doubts, we'll close today.
Yeah, thank you very much. Every day is a period of learning. Thank you, Jivanti. Thank you, Dr. Amma. Thank you, Annie. Thank you, Dr. Zikash. Thank you all.